Welcome to the deep dive. Today, we're tackling a really transformative topic.
We really are.
It's all about how artificial intelligence is, well, fundamentally changing healthcare applications.
Yeah.
We've sifted through the sources you sent, pulled out the key insights, maybe some surprising bits too. The idea is to get you quickly up to speed on this fast-moving field.
It's definitely fast-moving, and
Yeah.
the scope is it's huge. AI in healthcare apps, it touches everything from, say, spotting diseases early on, right through to creating super personalized treatment plans.
And telemedicine too, I suppose.
Oh, absolutely. Telemedicine's a big one. And you have features like real-time health monitoring, predictive analytics. It really empowers patients and doctors in new ways. Smart capabilities.
And the market reflects this, doesn't it? The growth is just staggering.
It really is.
Your sources mentioned the global generative AI and healthcare market valued at, what, $0.8 billion USD in 2022?
That's right. Seems like a lot, but
But get this, the projection for 2032 is USD 17.2 billion. That's huge.
it's phenomenal growth. A compound annual growth rate of 37%.
37%. That's not just a small shift, is it? It suggests like a complete re-engineering of how healthcare works, driven by the potential for, well, efficiency we haven't seen before.
Exactly. And what's driving that rocket ship?
Good question. What is behind that kind of growth?
It looks like a perfect storm, really. You've got this massive increase in digital health data available.
Right, wearables, electronic records?
Exactly. Then there's a growing demand from patients for truly personalized medicine, not one size fits all.
Makes sense.
And, frankly, the ever-rising cost of healthcare. AI offers a potential way to make things more efficient and maybe bend that cost curve.
Okay, that paints a really compelling picture. So let's dig into that foundational impact. You said AI isn't just a trend, it's more like a revolution.
I think that's fair to say, yeah.
Huh.
It's fundamentally changing how doctors, nurses, everyone in healthcare delivers care. It makes it potentially more accurate, certainly faster, and definitely more efficient.
And what are the actual technologies, the AI engines driving this?
So the core tech really boils down to a few key things. Machine learning, or ML. That's where systems learn from data patterns without being explicitly programmed for every single task.
Okay.
Then you have deep learning, DL, which is a bit more complex. It uses these things called neural networks, really powerful for tasks like, say, analyzing medical images.
Like X-rays or scans.
Precisely. And natural language processing, NLP. That's crucial because it lets computers understand and process human language. Think doctor's notes, patient reports, that sort of thing.
Got it.
These are really the workhorses. And it's not just us saying it. The Future Healthcare Journal back in 2021 called AI a powerful and transformative force, one that's really poised to revolutionize the practice of medicine and the delivery of healthcare.
Okay, so revolutionized how exactly? What are the tangible impacts we're seeing day to day in clinics or hospitals?
Well, the impacts are pretty broad. First off, automation of routine tasks. Big one.
Like scheduling,
Yeah.
billing.
Yes, those,
Yeah.
but even more complex admin stuff. Think about getting pre-authorizations from insurance companies. That takes up so much time. AI systems are starting to handle that.
Wow, okay. That alone must free up a lot of human hours.
Thousands of hours across a hospital system, easily.
Mm-hmm.
And it frees up staff for, actual patient care. Second big impact, improved decision-making.
How so?
AI can analyze absolutely vast amounts of patient data, medical history, genetics, lifestyle factors, current results, way more than any single doctor could possibly process.
Right.
And based on that, it can suggest potential treatment plans, flag risks maybe a human would miss, or even forecast potential future health issues for that patient.
That's a fundamental shift, leveraging data on that scale. And you mentioned early diagnosis earlier.
Yes, that's critical.
Yeah.
AI algorithms are getting really good at spotting subtle early warning signs of serious conditions.
Like cancer, heart problems.
Exactly. Cancer, heart conditions, diabetes, often from analyzing images or data patterns before obvious symptoms appear, things a human might overlook.
That could save lives.
Potentially, yes. And finally, optimizing patient care overall. AI systems can track a patient's history, their current symptoms, and then recommend the most effective treatments tailored specifically to them.
Tailored how?
Maybe by matching their specific genetic profile and history against this huge database of treatment outcomes for similar patients. Really personalized.
Okay, that's the big picture, the system level. But for many of us, healthcare interaction is increasingly happening, well, on our phones. How does this AI power filter down into the apps we actually use?
Ah, yes. This is where it gets really tangible for the individual. AI is enabling these smart solutions right in our pockets, essentially.
So what kind of features are we talking about?
Key things include real-time monitoring,
Yeah.
apps connect to your wearables, fitness trackers, smartwatches, maybe even medical sensors.
Right.
And they constantly collect and analyze your vitals. If something looks off, like an irregular heartbeat pattern, boom, an alert can be triggered automatically.
That's immediate feedback.
Yeah. Very immediate. Then there's predictive analytics. AI-driven apps look at your past health data, your current data, and can actually predict potential risks.
Predict. Like what?
Maybe predicting the likelihood of, say, an asthma attack, or a flare-up of a chronic condition, or even a higher chance of developing diabetes based on trends it's seeing. It's not fortune-telling, it's spotting subtle patterns.
So it helps you get ahead of problems, proactive rather than reactive.
Exactly. And that leads to personalized health management, which you touched on.
Right, tailoring advice.
Precisely. AI algorithms create health recommendations just for you. Personalized workout plans, specific dietary suggestions, reminders for medication or treatment schedules, and it adapts as your health data changes over time.
Very dynamic.
And one more sentence. Automated diagnostics are starting to appear. Apps where you can input your symptoms, maybe even upload some data, and the AI analyzes it to suggest potential conditions and guides you on what to do next. Should you see a doctor? Is it urgent?
Wow, that initial guidance could be huge, especially for accessing care or just knowing what to do next. And these aren't just theoretical ideas, right? There are actual apps doing this now.
Oh, absolutely. These are real-world applications making a difference.
What are some examples that stand out?
Well, you have some big players. IBM Watson for oncology is a well-known one. It uses what they call cognitive computing, basically, trying to process information like a human expert.
To help with cancer treatment?
Yes. It analyzes massive amounts of medical literature, trial data, patient records to help oncologists develop personalized cancer treatment plans. Then there's Google's DeepMind. They had a significant project predicting acute kidney injury much earlier than standard methods by analyzing patient data trends.
Early intervention is key there.
Hugely important. And it's not just the tech giants.
Right. What else is out there? Maybe more focused applications.
Definitely. There's Path AI, which uses AI to help pathologists analyze biopsy samples more accurately. Better accuracy in identifying disease means better, earlier treatment decisions.
Improving the pathologist's workflow.
On potentially their accuracy, yeah. Then there's IDXDR. That uses AI to screen for diabetic retinopathy damage to the eye's retina caused by diabetes.
How does that work?
It analyzes images of the retina, often taken with a special camera right in a primary care doctor's office, and can detect the condition quickly and accurately. Makes screening much more accessible.
Okay. And what about apps for direct patient use? Symptom checkers and things?
Yes, apps like Ada Health or Buoy Health are good examples. They're AI-powered symptom checkers. You describe your symptoms, answer questions, and the AI provides potential causes and guidance on whether you should seek medical attention and where, like a virtual health assistant.
Okay, so from our phones and specific apps, let's zoom back out a bit to the clinic itself, and also telemedicine, which you mentioned is booming. How is AI changing actual clinical practice diagnosis, treatment selection, lab tests?
Yeah, within the healthcare system itself, AI integration has really significant potential. It enhances diagnosis, helps choose the best treatments, even improves clinical lab testing.
How? By leveraging data.
Exactly. By leveraging these massive data sets far more than any human could manage and finding those subtle patterns that lead to more precise insights. The benefits this brings to clinical practice are pretty wide-ranging.
Right, so you get things like, I assume, increased accuracy, lower costs, time savings.
All of those, yes. Increased accuracy, reduced costs, significant time savings, and importantly, minimizing the potential for human error in certain repetitive tasks.
And it feels like it really fuels that push towards personalized medicine we talked about.
Absolutely. It helps optimize medication dosages for individuals, not just standard doses, and it enhances population health management too, spotting disease trends across communities.
What else? Does it help with guidelines or patient interaction?
It does. AI can help establish evidence-based clinical guidelines by analyzing outcomes data. It provides those virtual health assistants for answering routine patient questions 247. It can even support mental health care by analyzing behavioral patterns from app usage or journals.
Interesting.
And it improves patient education materials, making them more relevant. Some argue it even strengthens the patient-physician trust, because the doctor comes in more informed, using AI as the tool.
Okay, and specifically in telemedicine, you said it's a gateway. How is AI changing remote consultations?
It's making them much smarter and more effective. Telemedicine platforms with AI can offer really robust consultations remotely.
How so? What are the AI features?
Well, first, those virtual health assistants we mentioned, AI chatbots available anytime. They can handle initial patient queries, help schedule appointments, maybe even do a basic symptom triage before you talk to a human.
Okay, so it streamlines the process.
Definitely. Then, during AI-driven video calls, the AI can potentially analyze things like the patient's facial expressions, their tone of voice, even gestures,
Seriously, to help
to
diagnose.
provide additional context for the physician. Yeah, it's like another layer of observation to help build a more comprehensive picture, especially when you can't do a physical exam.
That's fascinating.
And another practical thing, automatic documentation. AI transcription services can automatically create records of the consultation, saving the doctor time and ensuring accuracy.
That sounds incredibly useful for the clinicians. So, boiling it down, what are the main advantages of AI in telemedicine for patients and the system?
I'd say three key things. One, much wider access to healthcare. It connects patients in remote or underserved areas to specialists they couldn't easily see otherwise.
Big deal for equity.
Huge. Two, reduced wait times. AI can help pre-screen patients, prioritize urgent cases, making the whole system more efficient.
Get people seen faster.
Right. And three, potentially improve diagnostics even during remote consults. The AI can analyze the available data, suggest possibilities to the doctor, helping maintain high-quality care, even from a distance.
Okay, that's a clear impact on how care is delivered remotely. Now, let's shift gears again, maybe to the real cutting edge, AI and medical science, research and discovery. How's it impacting things like drug development, disease research, genomics?
This is where AI is truly revolutionary, I think. It's changing how research is done, finding patterns, making predictions, things that were impossible or would take years before.
Like in finding new drugs.
Exactly. Drug discovery is a prime example. AI can analyze vast libraries of chemical compounds, predict how they might interact with disease targets, and identify the most promising candidates for new drugs much, much faster. It can cut years off the development timeline.
That's incredible. And genomics, handling all that genetic data.
AI is absolutely crucial there. Analyzing complex genomic data is a massive computational challenge. AI helps identify those tiny genetic mutations linked to specific diseases, which is fundamental for developing personalized treatments based on your unique genetic code.
So truly tailoring medicine to the individual's DNA.
That's the goal.
And what about clinical trials? They always seem so slow and expensive.
AI is helping there too. It can optimize the design of clinical trials, help find and recruit the right patients faster, and monitor trial progress more effectively. This makes trials more efficient, potentially cheaper, and yield better results.
So overall, how does this enhance the research process itself?
It speeds up discoveries dramatically. AI can crunch decades of clinical data in like seconds, finding patterns humans might never spot.
Removes bottlenecks.
Big time. It also increases precision. By analyzing data objectively, AI can help eliminate some human biases that might creep into research.
More reliable results.
Hopefully. And it allows for predictive modeling. Researchers can use AI to simulate how diseases might progress or respond to different therapies before testing them in people, helping develop effective treatments faster.
That focus on prediction links nicely to preventative care. Let's talk about AI in everyday healthcare and wellness. How is it empowering us to manage our own health better, using data from, Fitbits and smartwatches?
Right. This is where AI directly impacts our daily habits and preventative strategies. It takes all that data from wearables and trackers and turns it into personalized advice and insights.
So beyond just counting steps.
Oh, way beyond. Think about health monitoring. AI-driven wearables track heart rate, sleep quality, activity levels, stress levels, calorie intake, and then the AI provides actionable insights based on your patterns. You slept poorly after eating late, or your stress levels seem high on work days. It's like a constantly updated personal health dashboard.
It feels like having a personal health coach.
That's a great way to put it. We are seeing AI fitness coaches emerge in apps. They use machine learning to create truly personalized workout routines, suggest specific dietary changes based on your goals and progress, and adapt as you go.
Very cool. And it's not just physical health, right? Mental wellness, too.
Absolutely. AI is being used in mental health apps. It can analyze patterns in your mood entries, journal text, even usage data to detect early signs of stress, anxiety, or depression.
How does that help?
It can then prompt you to use specific tools within the app, like guided meditations, or suggest seeking professional support, often before you might even recognize the need yourself.
Are there well-known apps doing this kind of thing effectively?
Sure. Fitbit is a classic example, integrating AI with its trackers, not just for activity, but for personalized sleep analysis and wellness recommendations.
Right, sleep tracking is big now.
It is. And an app like Headspace, focusing on mental wellness, uses AI to tailor mindfulness exercises and meditation sessions based on your stated goals, your mood, and what you've responded well to previously. Makes it feel more relevant and effective.
Okay, so all this amazing potential needs to be actually built into usable solutions. Tech companies must play a big role here, integrating AI into healthcare apps. How does that work?
Yes, specialized companies are key. Their expertise is precisely in taking these powerful AI technologies, ML, NLP, predictive analytics, and weaving them into practical mobile and web applications for healthcare.
So they bridge the gap between the AI research and the user.
Exactly. Companies like WeblineIndia, for instance, that's their focus. Delivering those real-time insights, helping improve diagnoses through app features, optimizing patient outcomes by building AI into the tools doctors and patients use.
And how do they specifically enhance these apps? What kinds of features do they build in?
They focus on several key areas. First is just the basic AI integration, helping clinics or hospitals add AI features to their existing systems or build new smart apps from scratch, making healthcare delivery smarter, more efficient.
Okay.
Second, enabling data-driven decision-making. They build tools using AI that give doctors predictive analytics, real-time patient data analysis right at their fingertips to inform decisions.
Supporting the clinicians.
Absolutely. Third, building out telemedicine with AI, creating those apps that include the virtual assistants, the symptom checkers, the automated diagnostics we talked about to make remote care really robust.
Right.
And finally, they often develop custom AI features. Maybe a hospital needs a specific AI-powered chatbot for patient questions, or a unique system for creating personalized physical therapy plans, or integrating clinical decision support alerts into their electronic records. They build those tailored solutions.
This has been incredibly illuminating. This deep dive really shows just how fundamentally AI is transforming healthcare. It's clear it's making things smarter, more efficient, and hopefully more accessible for everyone.
I think that's undeniable. AI in healthcare apps, and just AI in healthcare generally, it's bringing major improvements across the board. Diagnosis, treatment, patient care. Even reaching people in ways that just weren't possible a decade ago.
Yeah. It's obvious AI is this incredibly powerful assistant, especially for diagnostics, right? Sifting through data, spotting patterns faster than any human could.
Definitely a powerful tool.
But it does raise a final question, something for you, our listener, to think about. While AI is amazing at analyzing data, it can't replicate, well, human clinical judgment, empathy, the complex ethical decisions doctors make.
No, it certainly can't replace that human element.
So what does this ongoing collaboration, humans working with AI, mean for the future of patient care? And maybe what's the evolving role of the physician going to look like in this increasingly AI-augmented world? Something to consider until our next deep dive.